So for question 3, the authors have a couple recommendations for handling deep intimacy and how to handle that with the patients. First, they say that all members of the transdisciplinary team should have spiritual care experience, education, and training. I think that that's something that's much easier said than done, especially in a world that tends to be so politically correct at times. So they think that having spiritual care experience, education, and training would be beneficial for all healthcare practitioners. I think Kettering really does try to do that, but it's, again, easier said than done. The authors state there's a deep intimacy in the spiritual domain. Spirituality is an aspect of life that is close to the core of the person, and that to have access to that intimate aspect of a person's life demands that one granted such access exercise care, restraint, and confidentiality. So they're saying that spirituality is really the core of a person, and that if you're going to be treating them and the core of their being, then you need to be very careful with that. They talk about at the end of life, which is kind of what some of our questions have been over, but they say that at the end of the life, spirituality and the spiritual needs are important, but they're not just important at the end of life towards death. They're important at the whole spectrum of the lifespan. And they need to be treated important throughout the span of the lifespan as well. And as far as like spirituality and religion in your care, you need to follow the patient's lead. I think that these are really important things to remember. I think it's easy in a world to think, yes, I'm going to really think about everyone's spirituality and religion while I'm treating them, but when you have, like at least for OT, when you have a certain amount of time with each person and you have a certain amount of minutes you need to meet for treatment, it can be, I think, hard to keep that as centered as we can. I think with OT and other healthcare professions being client-centered, I think that'll help. But I think, again, it's much easier said than done, and I hope it's something that I can continue to work on in the future. For question 4, the basic principles and communication practices of patient-centered assessment and care recommended that all healthcare practitioners should adopt, follow the patient's lead, talk to them, right? So figure out, what does spirituality or religion mean to you? Is it important? How are you doing with all of this? Do you have any big questions? Stuff like that. Follow their responses, both verbal and nonverbal. If you're making someone uncomfortable, then maybe that's the time you back off. But if somebody seems comfortable and wants to talk, that's when you could try to have a bigger, better conversation. You need to be really open and understanding of all different types of beliefs. So not everybody is going to be Christian, right? But everybody still has spirituality and religion. I think it's really important to remember that it's your beliefs are your own and they're important, but you can't let that rub off on other people's beliefs. You have to meet them where they are. Be client-centered. For occupational therapy, when you do an occupational analysis, an interview, and client profile, you do ask about religion and spirituality, and I think from there that gives you a good point to gauge how important that is going to be to the person, depending on how they talk about it. Respect, patient-centeredness, and inclusivity, these are all principles that we're taught to follow as occupational therapists, and hopefully you guys are taught that too in the PA program. I'm sure you are. And so I think all those are really important, but at the end they did include also that boundaries need to be recognized in the patient-client relationship. Like I said earlier, you have to meet your minutes, you have to do your therapy, and I know that the spirituality is the core of the person, but you need to value that relationship, and it can't all just be heart-to-heart conversations. So this chapter is really interesting. I think a lot of this is easier said than done, so I'm interested on your guys' feedback.